Welcome to Health Policy, Organization, and Finance. This is your Week 14 video. In the last 2 weeks of the course, we're going to look at public health organizations. One of the difficulties with public health organizations is they come in all shapes and sizes. We discussed finance and policy first because I think those are less confusing things to think about than public health organizations. One of the reasons why public health organizations are hard to identify is that the concerns can be global, national, regional, or local. They can be federal government, state government, local government, county government. They can have a lot of employees. They can have very few employees. They can have just parts of employees who dedicate certain amounts of time to certain public health things. And oftentimes, people who do really good public health work are not at an organization that thinks of itself as a public health organization. But they actually are doing a lot of work to improve community health. So, another caveat I just wanted to point out is that although we often think of the World Health Organization or the federal CDC as really important public health organization, a lot of the most important public health work is done by local public health entities because they are the ones that really understand the local government, the local community, the local environment, the local culture, and the local norms, and they can get really the best work done. I also wanted to point out that there is the Prevention and Public Health Fund, which was meant to be a stable funding stream for public health in the United States. This was part of the Affordable Care Act. You'll see a little bit about this in the readings this week. There is a website under HHS, and you can see where that money goes every year. So if you're interested, I would check that out. So to understand public health organizations, you really have to understand what exactly is a public health entity. Well, the definition really is these are public, private, and voluntary entities that contribute to the delivery of essential public health services within a jurisdiction. Now, we know what those public health services are because we talked about them way back in the beginning of the course. But those are basically entities that improve health for a community. Again, these agencies can be at different levels of government. They can be at state, they can be at city, they can be at the federal level. But you can also have public health entities working within a healthcare provider. So if you have a hospital network, there's probably public health work being done there. Public safety agencies, a lot of work is done through human service agencies, so Child and Family Services or Office of Aging and Disability, youth organizations, recreation and arts related organizations, philanthropic organizations, environmental agencies. A lot of these are not outwardly looking like public health agencies, but actually do a lot of the day-to-day work of public health. So where does the money come from to pay for these public health entities? Well, it's mostly federal sources. The federal government pays for most of public health in the country, which is why the Federal Public Health Fund under the Affordable Care Act was so important. A lot of times for federal, when federal money goes to states, there's stipulations. So the states will match the federal funds with equal amounts or by some ratio, or States might have dedicated tax funds or revenues that come into the states that are dedicated for public health issues, or sometimes there's private money like endowments or charitable gifts given. What I want you to know is that the federal government really pays for public health in this country by the majority. A lot of this funding is comes with a lot of stipulations. One might be, matching funds from the state. Another is it could be targeted to particular issues or diseases. So there's federal money, but this will go out to organizations that help decrease tobacco use or help decrease domestic violence. The primary federal agencies that have this money that kind of push it out into all the other smaller public health entities are the ones you know off the top of your head: the CDC, the ASPR, the HRSA. So it is kind of a trickle-down mechanism in that the federal government has the most public health money and it pushes it out down to the state, regional, county, or local public health entities. But keep in mind that money usually comes with quite a few stipulations. Who are the federal public health entities? Well, there's a lot. I provided a brief list for you here. Some of them you may know, and some of them you may not know. And it's hard to give you a list of state public health agencies because each state might have different public health entities. For instance, Vermont might have a state public health office, whereas another state might not have a public health office. Maybe they have public health under their Center for Disease Control or in their Department of Health and Human Services, or sometimes even under their licensing division or vital records and statistics division. So each state really deals with public health pretty differently. Some states even have it set up by county. So if you look at some states like Alabama, the public health departments are part of the counties, and that's how public health is worked on in that state. Some states have regional public health entities like Massachusetts. It's based more on population and where urban centers are. And then some states have city public health departments. New York City has a huge public health department, but small states like Maine has the public health departments in Portland and Bangor. There's also non-governmental public health entities. So you can have hospitals or doctor's offices or groups like Catholic Charities, Volunteers of America, Goodwill can all have public health portions of their nonprofit entity. And you can also have coalitions. So you might have a group of people who are either a committee or a subcommittee that don't necessarily have a singular organization that they work for, but they come together to look at data and create an output, which is either reports or suggestions. These are public health entities, but they don't have employees and offices. They're kind of a subgroup of the government. So I don't want to have a very long video this week. Please check out the readings. Next week, your final policy paper will be due, so please send along your questions this week. And that's it for week 14. Have a great week.